I want you to try something before I say anything else. Sit forward in your chair. Cross your arms over your chest so your hands are on your shoulders. Now stand up without using your hands, then sit back down under control. If you manage that, do it again and see if you can do 5 in a row. Take your time. There is no rush. Now, most videos would tell you that if you can do it, you are fine and move on. I want to do something more useful than that because there are two completely different reasons a person cannot get out of a chair without their hands. One is slow, it builds over years, it is the common one, and it is largely reversible with the right work. The other comes on over weeks or a few months, and it is a signal of something specific. I am going to spend the second half of this video on that one because it includes a condition that is common in people over 70, frequently missed, and responds to treatment so quickly and so dramatically that patients describe it as being handed their life back. If your ability to rise from a chair has changed recently, please stay to that part. But first, let me give you the numbers because I want you to know how you actually compare. Researchers Roberta Rickley and Jesse Jones developed something called the Senior Fitness Test and published normative data gathered from over 7,000 community-dwelling older adults across 21 American states. The version they used is the 30-second chair stand. Same movement, arms crossed, but you count how many complete stands you manage in 30 seconds. Here is roughly how it falls out. For adults in their early 60s, the middle range is about 14 to 19 stands for men and 12 to 17 for women. Performance declines steadily across each 5-year bracket, with the steepest drop after age 80. Men typically complete 1 or 2 more than women. Broadly, for older adults, under about 14 for a man or 12 for a woman in that younger bracket is below average, and above 19 or 17 is above average. Now, please do not treat those numbers as a verdict. Weight affects the score more than height does. Knee and hip arthritis affect it. Chair height affects it, and the standard research chair is 17 inches. What matters far more than the number is what it looks like 6 months from now. That is the test. Not where you are, but which direction you are moving. Now, let me explain why this particular movement carries so much information. Standing up from a chair is one of the most demanding things you do in ordinary life. To rise, your muscles must generate force greater than your body weight, quickly, while your center of mass travels forward and upward, and your balance system keeps you over your feet the entire time. Most people do it dozens of times a day without a thought, but notice what happens as it gets harder. First, people start pushing off with their hands. Then they rock forward to build momentum. Then they choose higher chairs and avoid low sofas. Then they need a raised toilet seat. Then they need help. That is a staircase, and people descend it one step at a time over years, adapting so gradually that they never notice they are on it. Which brings me to the slow cause. It has a name, and since 2016 it has had a formal disease classification code of its own: sarcopenia. The word simply means loss of flesh. It is the age-related loss of muscle mass, strength, and function, and it is not merely getting weaker, it is a recognized condition. Here is what happens biologically. From roughly your 30s onward, you lose muscle mass steadily, and the rate accelerates after 60. But the loss is not uniform, and this next detail is the one that matters most. You preferentially lose the fast-twitch fibers. Those are the fibers responsible for producing force quickly, which is why muscle power declines considerably faster with age than muscle strength does. And power is what you need to stand up from a chair. Power is also what you need to catch yourself when you trip, because a stumble recovery has to happen in a fraction of a second. This is why some people can push heavy things and still cannot rise from a low seat and cannot save themselves from a fall. Strength and speed are not the same currency. Now, 3 things accelerate this, and I want you to know all 3. The first is inactivity, which is obvious. The second is protein, which is less obvious. Older muscle becomes less responsive to protein, a phenomenon researchers call anabolic resistance. The same amount of protein that built muscle at 30 produces a smaller response at 75. So older adults actually need more protein per meal, not less, and spread across the day rather than concentrated at dinner because the body handles it better that way. Meanwhile, appetite tends to fall. The two trends work against each other. The third accelerator is the one almost nobody talks about, and I think it is the most important: bed rest. Studies of healthy older adults confined to bed have found substantial losses of leg lean mass within about 10 days. 10 days. Think about what that means in practice. A chest infection, a hip operation, a bad flu, a week in hospital. A person goes in, able to rise from a chair, and comes out unable to, and everyone concludes they have declined with age. They have not aged. They have deconditioned. And that is a different thing entirely, because deconditioning can be reversed. If you or someone you love is admitted to hospital, ask about getting out of bed and moving as soon as it is medically safe. Ask about physical therapy. That single question changes outcomes. If this is useful to you, tell me in the comments how many chair stands you managed. I read every one. Now, the encouraging part, and it is genuinely encouraging. Muscle responds to training at every age that has been studied, including in the 80s and 90s. The stimulus that works is resistance, meaning your muscles working against a load. Walking is excellent for many things, but it does not build much lower body strength on its own. Here is the simplest possible program, and the exercise is the test itself. Sit to stands. Use a chair you can manage. If you need your hands at first, use them and simply use them less over time. If a standard chair is too low, start with a higher one and lower it as you improve. 3 sets of 5 to 8 twice a day. Rest between sets. Then progress in this order. Lower the chair, slow the descent down to 3 seconds, because lowering under control builds strength surprisingly effectively. Then pause halfway down for a moment. Then, when it is easy, hold something with weight against your chest. Add step-ups on a bottom stair, holding the rail. Add calf raises at the kitchen counter. And be patient, because meaningful change takes 8 to 12 weeks, not 1. Pair it with protein at each meal, because training without the building blocks gives you a smaller result. Now the part I asked you to stay for. Everything I have described so far is slow, years. But if your ability to rise from a chair has changed over weeks or a few months, that is a different situation, and it deserves a proper look rather than a training plan. Doctors call this pattern proximal weakness. Proximal means close to the center of the body, so the muscles around the hips and shoulders rather than the hands and feet. Here is the pattern to recognize, and it has 2 halves. Difficulty rising from a chair or from the toilet or getting out of a car, together with difficulty raising your arms above your head, so washing your hair, reaching a high shelf, or putting on a coat. Hips and shoulders both over a relatively short time. If a peripheral nerve problem were responsible, you would expect the hands and feet to be affected, not the shoulders and hips, so that combination points somewhere quite specific. Let me give you the main causes. The first is the one I most want you to know about: polymyalgia rheumatica. It is an inflammatory condition that almost exclusively affects people over 50, with the average age at diagnosis around 73, and incidence peaking between 70 and 80. So it is a condition of precisely the age group watching this. Here is the classic presentation: pain and stiffness in the shoulders and hips on both sides, morning stiffness lasting more than an hour, sometimes much longer, stiffness that returns after sitting still for a while, and difficulty rising from a chair, turning over in bed, or lifting the arms above shoulder height. In about half of patients, the onset is abrupt. People often remember roughly the week it started. Now, why does it get missed? Because pain and stiffness in an older adult get attributed to arthritis, or to aging, or to having done too much in the garden, and people wait, sometimes for many months. Here is why that matters. Diagnosis is clinical, supported by blood tests showing raised inflammatory markers, and the response to treatment is a large part of the picture. That response is often striking. Patients commonly improve within days of starting low-dose steroid treatment. I have had patients tell me that after months of struggling to dress themselves, they woke up on the 3rd morning and simply got out of bed normally. Now, an important safety point that goes with this. Polymyalgia rheumatica is closely related to another condition called giant cell arteritis, and a meaningful proportion of people with one develop the other. Giant cell arteritis can cause permanent vision loss. So if you have this pattern of shoulder and hip stiffness, and you also develop a new headache, particularly at the temples, scalp tenderness, so that combing your hair hurts, jaw pain when chewing, or any visual disturbance, that is not a wait-and-see situation. That is urgent, same day, because sight loss can be prevented but not reversed. Now, the other causes of proximal weakness worth knowing. Statin-related muscle problems. Statins are important medications, and I have spoken elsewhere about not stopping them on your own. But muscle aching and weakness is a recognized side effect, and it is worth raising with your doctor rather than enduring, because there are alternative statins and alternative doses. Thyroid disease, in both directions, can cause muscle weakness, and it is a simple blood test. Severe vitamin D deficiency can cause a genuine myopathy with proximal weakness and difficulty rising from chairs, and that is both easily tested and easily corrected. Long-term steroid use for other conditions can itself cause muscle weakness, and there are inflammatory muscle diseases such as polymyositis, which are less common but present in a similar way, sometimes with swallowing difficulty. Notice something about that list. Nearly every item on it is treatable, which is exactly why a recent change in your ability to stand up should not be filed under aging. 3 honest statements before I close. The normative numbers describe groups and are affected by weight, chair height, and joint problems, so please do not treat a score as a verdict. Sarcopenia is common, and the slow explanation is the likeliest one for most people watching. And this video is education, not medical advice. I am a physician, but I am not your physician. Now, the things that mean a phone call rather than a training plan. Any change in your ability to rise from a chair over weeks or months rather than years. Weakness in the shoulders and hips together, especially with morning stiffness lasting more than an hour. New headache with scalp tenderness, jaw pain on chewing, or visual symptoms, which is urgent today. Muscle pain with dark or cola-colored urine, which needs urgent assessment. Weakness on one side only, which is a different problem entirely. Any new difficulty swallowing, and any fall in the past year, even one you got up from and told nobody about. Let me finish with this. If you stood up 5 times without your hands, you have more lower body power than a great many people your age, and that is genuinely worth knowing about yourself. If you could not, and it has been that way for years, then you have found the single most trainable thing in your body, and you already know the exercise because it is the test. But if you could do it last spring, and you cannot now, please do not train harder. Please make an appointment and say these words. I have developed weakness in my shoulders and hips over the last few months. That sentence, said to a doctor, points directly at a short list of conditions, most of which are treatable and one of which can have you feeling markedly better within a week. Tell me in the comments whether you managed 5 and whether it feels different than it did a year ago. That second part is the one I am actually asking about. Take care of yourselves, and I will see you in the next one.